Welcome to the Unhealthy Policy Podcast, where we break down how policy decisions in Washington actually play out in our hospitals, clinics, and communities.
Hello, everybody. We're back. My name is David Roach, and I am an infectious disease doctor.
We have so many loyal listeners. I think people know us already. But for those who are joining for the first time, I'm Jake, also an infectious disease doctor. And what are we doing today, David?
Well, I think one important thing that we're both doing today, Jake, is having the occasional drink to the challenging days that we're finding ourselves in, and as we struggle to get through them.
Cheers.
It's important to have the occasional cheers and beers. But what we're talking about today is a grab bag of bullshit, and it's RFK Jr.'s impact and influence on national healthcare policy in his role as the director of HHS, which, as we've discussed before, oversees a huge component of the US healthcare system, including the CDC, the NIH, among others. So that's what we're after, the grab bag of bullshit.
So, David, I thought to get us started here, let's just look at some clips of RFK, and you don't know what's coming, and just kind of give your first reaction here.
If you had a child today, would you vaccinate that child for measles?
For measles, probably for measles. What I would say is my opinions about vaccines are irrelevant.
Irrelevant. What do you think about that, David? Agree or disagree?
Look, the head of our national healthcare architecture, who oversees the vaccination plan of millions of children, thinking that his opinion on vaccines is irrelevant. I don't know. That would kind of be like my mom, who oversaw the raising of my family, thinking that my dinner habits are irrelevant. And she certainly had some opinions about using a fork and knife at the dinner table.
Let's see what else he has to say.
I don't want to seem like I'm being evasive.
Yeah.
But I don't think people should be taking medical advice from me.
Right. No, I got that. And I'm not asking you to give them medical advice, but would you?
What do you think, David?
That's the most wise thing I've ever heard him say.
David agrees with RFK.
Yeah. I think we're fully aligned in that. How can we get this guy to stop giving medical advice and setting medical policy? That's an important question. So, hey, point for RFK. Good policy.
Yeah, while we're on this topic of vaccines, do you want to maybe give a little background to kind of why we're in this situation? What are RFK's beliefs and how that's impacting policy?
RFK is an environmental lawyer by training and experience. Obviously, he comes from a very prominent political family in America, but he made his own way as a lawyer who was working to protect different rivers and natural resources, all fantastic work in that regard. And then since the early 2000s, it seems like he's really pushed an anti-vaccine agenda. He's become a definite anti-vaccine advocate. And he's been espousing many different theories, calling into question established scientific fact around vaccines and vaccinology.
I think what's so crazy about this, David, is that the national conversation, if you read like the New York Times, they'll often have pro-vaccine versus anti-vaccine. And it shouldn't be, air quotes, pro-vaccine. The data is very clear, and the vaccines that work should be available. And then when there's a vaccine that doesn't work, and there have been plenty that haven't been approved in many years, that intranasal flu vaccine is one example, then they shouldn't be on the market. But somehow he and others have politicized this into it's a belief as opposed to a data-driven decision.
At the same time, they're calling into question some of the science. They're casting aspersions that there's a giant conspiracy theory among pharmaceutical companies and the medical establishment around vaccines. And what that does is it really clouds the waters and kind of feeds into a general paranoia and that's been longstanding around vaccines, and supports and further empowers anti-vaccine movements because it aligns them with a variety of other kind of conspiracy-oriented movements. And it's not to say that there's not genuine discussion that should be occurring around the science and safety of vaccines. There is, and that absolutely occurs all the time. But unfortunately, when it's taken in a lens of a conspiracy theorist mindset, you ignore the data you want to ignore, and you only pay attention to what further supports this concept of conspiracy that, in my view, as somebody who works in this field, is totally unrealistic and not true.
People often will say, oh, he's just all talk. He hasn't really changed anything. But I want you to look at this clip that we got here
fresh
and then kind of
reaction.
just
All right.
react to it. Fresh react to it.
Hi, everybody. I'm Robert F. Kennedy Jr., your HHS secretary, and I'm here today with NIH Director Dr. Jay Bhattacharya and FDA Commissioner Dr. Marty Makary. I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
What do you think about that, David?
That one genuinely makes me angry. I am not a pediatrician. I didn't take care of a single kid with COVID directly, but I did take care of multiple pregnant women. And I had actually 2 pregnant women that died from COVID. One of them I watched die in front of me, and I was the one there with her mother and her husband. So these are things that I saw with my own eyes. Polling recommendations around things that have well-established safety profiles only serve to hinder protecting people who need to be protected. And for me, that really hits close to home, having directly witnessed the tragedies that can unfold in people who get this infection and they're pregnant.
The reason we're vaccinating pregnant women is twofold. One, as what David said, is to protect the mother. You have to have a healthy mother to have a healthy baby. But then the baby's also protected after they're born. And there's very good data, very clear data that pregnant women who get the vaccine, and this was true for the initial series, it was true for subsequent boosters, their children are less likely to get hospitalized, less likely to get severe COVID in the first 6 months of life, with a resounding effect size, something like over 50%. So this not only protects the moms, but also protects the babies. And there's really, really, really good data to support that. We're not just making it up. So this is going to hurt pregnant women, it's going to hurt children, and definitely going to hurt unborn children in their first 6 months of life. And I know we're in a different part of the pandemic, but all babies that are born today, they don't have any antibodies from the previous COVID infection. They don't have any antibodies from previous vaccination. So in my mind, this is a first vaccine that they're going to see. So this is a specific example of how it's not just talk. It's not just RFK saying vaccines don't work, et cetera. He's actually now able to dictate policy. And when the CDC doesn't recommend a vaccine, insurance companies are less likely to cover it. And doctors are honestly less likely to give it. Doctors can't always look at all the primary data themselves. They often go by what the CDC says, what the ACIP says, which we're going to talk about in a minute. So very kind of frustrating development here. And this is pretty recent. This is from a couple of weeks ago.
And one other thing about this video that is profoundly frustrating is that Jay Bhattacharya is standing up there with RFK Jr. And he once upon a time was a respected clinician and scientist, well, an economist. And I think he's lost a lot of credibility among scientists and physicians because of his support of an anti-COVID platform. And so to see him get up there and rub elbows and ascend to power based on inflammatory and, in my view, backward positions is really disheartening.
What's really tricky about this current situation is you may think, okay, the current administration is not trustworthy when it comes to science. And if you think back to 2017, at that time, most people agree you could still trust the NIH. You could still trust the CDC. The difference with this time is he's now appointed people that heads up all of these institutions that also you have to be worried that you can't trust them. So now the official recommendations coming from the CDC are based on just what the head of the division wants. It's not based in the data. And I think that's a really scary time for both the population and also clinicians who rely on this information. It's hard to know what we can believe anymore.
And I think part of the rationale for that is that during the COVID pandemic, he lost a lot of credibility and had a lot of pushback just how that was handled. And the head of NIAID, Tony Fauci, who's kind of the head of the COVID response, was a major trusted figure for a lot of people on the left and became a boogeyman on the right. And I think the lesson that Trump took away is that people who are in healthcare, who are following the science, are following the facts, are going to have pushback against their platform at the administrative level when that platform gets in the way of science, it gets in the way of facts. And so he did what's an effective approach of installing their own people, and then they control the facts that are disseminated. So there are a few different things that I want to talk about today. As I mentioned, this is a grab bag of bullshit. None of these on an individual level are the most impactful things. Some of them are kind of funny, but taken as a whole, they speak to a lack of professionalism, a lack of understanding of the science and the practice of healthcare, and really just a terrible overall trajectory for where we're headed as a nation and as a healthcare system. We've discussed this in a different episode, but RFK Jr. has been a longstanding opponent of using vaccines. Most recently, we've seen evidence of this in the measles outbreak. Jake, can you tell us a little bit about what happened?
Yeah, so as people are probably aware, there's a measles outbreak outgoing across the United States, focused in smaller towns in Texas. And historically, when there's a measles outbreak, and you have a vaccine that is 99% effective after a couple doses, the strategy is really to vaccinate the entire community. And we actually saw that a little bit in Texas. A lot of parents who previously did not vaccinate their children, now faced with the reality of their kids actually getting measles, ended up getting the vaccine. But what RFK said around the time was he focused more on unproven treatments. So he talked about vitamin A, high dose vitamin A, as a way to try to treat measles. And comparing a treatment for a disease versus preventing a disease is not the same. We should, yes, treat disease, but we also should ideally prevent disease. And his comments around the MMR vaccine in this outbreak were coded as a way like, oh, if you know what I'm talking about, you don't really have to get it. But to the lay media it sounded like he was very quote, pro vaccine. And one way he does this, David, is he talks about informed consent. What is informed consent for people who may not be in this world?
Generally, informed consent means that you have a conversation with your physician or whoever about the risks and benefits of a given procedure or treatment, and then you're able to make a decision about what the best path forward is for you or your family or your kid or whatever it may be. And then you consent to that after being informed about those risks and benefits.
I think of informed consent a lot of time, how I talk about it at least, is like in research settings. So we're really not sure if a drug's going to be beneficial when it's in the early phase trials. We're not sure if it's going to be harmful. And we talk through this whole list of the possibilities. And when we're talking about vaccines, yes, we talk about the side effects, the very rare side effects, the common side effects, how you're going to feel. But by framing it as it's each person's individual decision, which, yes, at the end of the day it is, but when you frame it that way, it makes it really seem like the cons or the risks of the vaccine are super, super high and almost on par with the benefits. And for almost all these childhood vaccines, as you said, David, they've been studied for decades. They're all extremely safe with almost no side effects.
You make a great point. Couching it in that language of informed consent makes it sound like they're still experimental, makes it sound like they don't have decades of evidence behind them. It's a way of saying, we don't really know, maybe you don't need to do this. And when the reality is, it's better said, we know these are safe, we know these are affected, we strongly recommend it. If you choose not to, that's understandable, but that's not how we use informed consent typically. And he's trying to couch it in a way that makes it sound like this is an experimental process, and it's not.
In medicine, when we're prescribing someone a drug, even if 99% of people are going to do totally fine with absolutely no side effects, we definitely still list you might get nausea. There's a risk of diarrhea with this particular medication. And it's not that we're uncertain about it. It's just the reality of it. So, David, that was one example of some of the comments or the vibes, is what we call the last episode of RFK. But let's get a little bit deeper into the specific policies or how he's changing how the CDC functions. And one specific thing that came up was the ACIP vaccine panel. Do you want to give a brief overview of the changes that just happened?
The ACIP, or the Advisory Committee on Immunization Practices, is a panel of independent experts. So they're not CDC employees, they're not government employees. They're independent experts who come from the fields of infectious disease or immunology or epidemiology. Some are community members, nurses. So it's a broad swath of around 15 to 20 different people that serve on 4-year terms on that body. And what they do is they independently assess evidence around new vaccines and how to implement them at the national level. We'll talk a little bit more about that in a second, but there are also about 30 additional non-voting members of the committee that are liaisons. It's helpful, for my understanding, honestly, to know how a vaccine goes from the trial phase into how does it get into the ACIP's orbit and get to their recommendations.
So the drug companies do all the phase 1, 2, and 3 clinical trials. And despite what's out there, pretty much every single new vaccine is a randomized clinical control trial. It needs to show that it's effective versus either placebo or whatever the standard of care is. From that, they will submit this application to the FDA. And the FDA's job is to regulate the product. Should we approve this vaccine or should we not? So, for example, when the COVID vaccines were first developed, Moderna, Pfizer, et cetera, submitted the application to the FDA. The FDA then approved it. At the Advisory Committee on Immunization Practices, they're an advisory committee to the CDC. And what the ACIP does is how are we going to implement the program to give that vaccine? So what I mean by that is who should get the vaccine? Is it all pregnant women? Is it everybody? Should it be a shared decision-making model? Or should the vaccine not be recommended for people? And the reason this matters is that insurance companies and physicians often look to the ACIP recommendations for how they're actually going to use that approved product.
Yeah, it's one thing for the FDA to say that it's safe and effective to use it. It's another thing entirely to say, well, how do vaccines make their way into the society, into the world at large, really, but society at large, and American society in particular? A lot of the rest of the world looks to the ACIP for their recommendations around vaccines. We're kind of a model for how this is done.
The ACIP historically has been full of members who have published extensively on vaccines and are really the local and national experts on vaccines. One criticism by RFK of the historical ACIP panel is that it's just a rubber stamp, meaning every single thing that gets presented to them, they say, yes, vaccines for everybody, let's do it. That's not true. So, for example, in the early 2000s, one of the rotavirus vaccines, the ACIP recommended against it when there was a safety signal. Some of the intranasal live flu vaccines, the ACIP didn't recommend. Some of the pneumonia vaccines, they didn't recommend. All of this based on the evolving data that's coming through, not based on any kind of financial incentives or whims of the moment, but really looking at the hard data.
What happened with the ACIP? We've talked a little bit about what it is and what it does, but what's the current status of it?
Yeah, so what RFK did this month is he, quote, retired all current members of the ACIP. He called the ACIP little more than a rubber stamp for any vaccine and citing a need for a clean sweep.
Clean sweep. Sounds like a purge to me.
This purge was framed by Kennedy as absolutely needed to restore public confidence in vaccine science, which is just so aggravating because the reason a lot of the general public do not like vaccines anymore is because of RFK and his comments about it. So I don't really understand how this purging is going to restore vaccine uptake. So all 17 members were fired, and then he established a brand new panel with 8 members. So, David, who are some of the people that he appointed?
Some have previously served on the panel, many of whom haven't and are anti-vaccine advocates. But I think what's really important is that these people were all installed immediately after this previous purge. And so what that means is they didn't go through the vetting process, the application process, the rigid protocol of finding out whether these people deserve to be on this panel because of years of research and a deep understanding of the field. It's just this classic up is down, black is white thing where you say that you are doing something to increase transparency, and then you do a purge and you do an immediate installation of people without any sort of transparency about how you made that selection. And it's really just gaslighting all of us on what is happening at the national level. It truly is. I think we need to just call that out because this is not transparency. This is obfuscating the truth about who these people are. And it's really changing the structure of American healthcare in a way that is going to have far reaching effects.
I think, unfortunately, RFK thinks if you're an expert in a field, you are biased. It's really challenging then to come up with vaccine policy if you're RFK and you say, well, he can't be on the panel, she can't be on the panel because she's published about vaccines. So obviously she's going to like vaccines. And it's just like so mind boggling. We'll put this up on the screen, but if you look at the number of papers that the old members published on vaccines versus the new members, it's like an order of magnitude higher. Yes, some of the new members, as the folks that David mentioned, have published a little bit. And I'm not saying publishing should be the only criteria for it, but it just is a marker of expertise in the field.
Yeah, and it just shows that somebody has dedicated their life to thinking about a problem. I mean, they spend all their time thinking about this, working on ways to make it better, finding avenues for improvement. Certainly, if there were opportunities to call out risks on somebody else's vaccine, these people would do that. It'd be a huge publication for them. To me, that's the part that is so wild to think that scientists are in some sort of conspiracy. If scientists have the opportunity and have the data to call out fake science, it's career making for them. Of course, they're going to want to do that. So the fact that, these folks are incredibly well published in the field, are major experts, means that they've thought about this a lot, means that they know the problem well, and they come from a place of trying to make the field better. And I guarantee you, if you read their publications, not everyone is singing the praises of every single thing. All science calls out the bad aspects of what they're doing. You try and buff the good stuff, but it's not like you're shirking away from the bad. Literally every single paper has a section on the weaknesses of that paper. That's part of the process.
Yeah, we actually
So-
saw this with the ACIP panel for the COVID vaccines. If people remember, the J&J vaccine that came out had this very rare side effect where you get this thrombocytopenia and blood clots. And it was the AIC panel who then removed that recommendation for that vaccine and halted people getting that vaccine because they saw this safety signal. The people who, quote, believe in vaccines also know that sometimes there are side effects to medications and have the public's best interest at heart. The people that were appointed to this time have made very public comments about how they think just vaccine as a class in general can be harmful.
They chose to revoke Johnson & Johnson, a tiny little mom and pop shop making vaccines. This is a pharmaceutical giant. History and reality shows us that these people are not major biased individuals.
Yeah, and it's just one layer. While no system is perfect, I thought the model that previously was used with the FDA, then the ACIP, and then the CD signing off of it, there can never be one person, even if they wanted to, make a bunch of money by selling out to some junk company, one person could not do that. And it's just unfortunate that this conspiracy has kind of been brought up that people were doing it only for financial gain.
Yeah, I mean, there were 17 people, all of whom are prominent figures in independent institutions. They don't necessarily have a lot to gain. And now you've appointed your own little group of 8 people who were handpicked with zero process around how those selections were made. And that's ripe for all kinds of problems rather than independent, well-structured appointment process that is deeply vetted. I personally know 2 members who have been on the ACIP panel, one who was on it before during the COVID era when those vaccines were made, and one who recently fired from it as part of this purge. And both are just stellar people, like people who I look up to, I respect. I would love to get a beer with them. I would love to be on a paper with them because they're phenomenal clinicians and phenomenal scientists or community advocates in the medicine sphere. One of the things that has really struck me about RFK Jr.'s tenure at the top is that there are a lot of different cabinet level members who have been chosen for a variety of reasons, some of whom were Fox News hosts, some of whom were tangentially related to a field. RFK Jr. was selected in a very different way. He was dropping out of the race as a third-party candidate. After he was clearly not going to win, he first went to Kamala Harris and tried to join their campaign if he could get an appointment as the head of a department. She said no, appropriately. And then he said, well, let me just go ahead and ask Trump what we can do there. And so Trump said, Trump doesn't have any principles. Sure, join the campaign. But it was really just a backroom deal that was the most transactional political process, the greasiest, slimiest, most backdoor aspects of politics that you could imagine. And the reason that matters is because RFK Jr. is unique in that he is a true zealot. He is a true anti-vaccine, anti-science establishment, anti-health zealot. He's willing to do a lot more and go a lot further to cut down what we're doing as a country from a healthcare perspective.
A fundamental difference between 2017 as it relates to healthcare policy and current day with the same administration is Trump feels like he was burned by a lot of the scientists around when COVID happened. Trump has said he had never got credit for the great COVID response that he had. So he's trying to replace everybody in every institution with either people he made a background deal in or people that have similar thought process as he does or will do his bidding. And I think we're seeing it every level. So we're seeing it the HHS secretary. But David, I heard you want to talk a little about the Surgeon General.
I really don't want to dunk on somebody right now.
Hold on. Hold that thought about dunking. I got a clip for you.
Okay.
Only our diehard fans will understand this clip.
Just glad to hear we have a fan.
Oh,
Other than-
gosh. It's perfect.
Oh, good God. I think that is a DDCU walking around out there.
That is a walking DDCU.
Boston's got so much going for it, I gotta say. Lobster rolls and Dunkin' Plains.
Let us know in the comments if you understand this reference, and no one's going to post because no one understands the reference except David and I and my dad. Hi, Dad.
So to not dunk on this lady, don't you dare show that video again, but to just talk about who Trump nominated for the position of Surgeon General, who, honestly is not a major policy driver. They're a little bit of a figurehead and a cheerleader for health. Usually they're well established, very well respected, years of experience practicing physicians who have spent time in the trenches on the ground and have a long career demonstrating an experience and knowledge of the field. That is not what we're getting currently. Trump's new nominee was made at the recommendation of RFK Jr., and she is a health influencer, completed medical school at Stanford. I'm sure she's quite intelligent, but did not complete her residency. She dropped out toward the end of her residency. But importantly, she is not a practicing physician. And it's interesting to have somebody who's supposed to be the cheerleader and spiritual leader of our nation's physicians to not even be a practicing doctor. To me, that grinds my gears so profoundly because it just speaks to the lack of professionalism and the lack of understanding about what it means to be a doctor on the ground and what it means to be a true advocate for health for patients. Because I know that there are a lot of challenges with modern healthcare, but goddamn, do people work hard at it? And to just have somebody who isn't a practicing licensed physician trying to tell practice licensing physicians who are spending their years and tears in the trenches of medicine is unconscionable in my view.
David,
Jake?
is it healthy or unhealthy, the nomination of RFK Jr.?
Am frustrated by certain aspects of the American healthcare system and love working in it, who this nominee is, what it speaks to on the part of the administration and the powers that be is just a profound lack of understanding of how this shit works. I mean, they just do not get it. And they do not know how to provide healthcare to people. They do not know how to fund healthcare. They do not know how to do science. And all they know how to do is destroy the existing structure of the world at large, but certainly the healthcare and science world. And that's going to have cascading effects that are going to impact so many people so profoundly. And we're already seeing evidence of that nationally and certainly internationally. The healthiest thing RFK Jr. has said is do take medical advice from RFK Jr. So if we're just talking about that, very healthy. Couldn't agree more. The rest of it, tough stuff, Jake. Tough stuff.
So for me, David, what really stands out is that RFK is no longer just one voice in the public posting on Twitter. He is now leading our health agencies. So he is actually setting the policy, and we are seeing those policies, his anti-vaccine policies, slowly trickle into what the actual recommendations are. This is not just talk. This is now happening. The most recent example, no COVID vaccines for pregnant women. And then implication is that their babies won't have the COVID vaccine, and no COVID vaccines for healthy kids, based on no new data, based on nothing except his opinion. And I think, to me, that is deeply unhealthy for America. And I worry this is just the start of the erosion into fewer vaccines for the population.
I think it's a really important point that this has transitioned from being tweets on the Twittersphere or whatever the hell to real life policy that impacts millions. And when the rubber meets the road is when you are changing recommendations, guidelines, and approvals and cutting funding for different programs that are of great importance to the health population. That's what really matters. And that's where we're at. And that's what's happening.
And that's it for the Unhealthy Policy Podcast. I'm Jake.
And I'm David. We'll talk soon about something else bad.
Very unhealthy.
Cheers.
Cheers.